Antifibrinolytics. Antifibrinolytics action is opposite to anticoagulants because antifibrinolytics they prevent the excessive bleeding post-surgery and increase the stability of the clot, decrease the blood flow. That is why they're also called hemostatic agents. Contraindications to use antifibrinolytics. We cannot use antifibrinolytics in pregnancy, and also they cannot be used if the client has disseminated intravascular clotting, and also if the client has severe renal impairment. Examples of antifibrinolytics: it can be tranexamic acid or it can be aminocaproic acid. So these are two examples of antifibrinolytics. Hypercoagulation. If we use antifibrinolytics with estrogen or with the oral contraceptives, it may increase the hypercoagulation or cause hypercoagulation. So we need to be very careful about this interaction of antifibrinolytics with the estrogen and oral contraceptives. Antifibrinolytics nursing considerations. First of all, positive Homan sign. What is positive Homan sign? It is calf pain on the dorsiflexion of a foot and change in peripheral pulses and prominence of superficial veins. So whenever we are infusing antifibrinolytics, we need to be monitoring the client closely for any of these signs: change in the peripheral pulses, prominence of superficial veins, and positive Homan sign, because these indicate that the clotting has occurred in the arterial or in the venous vasculature. So we need to be observing the client closely for these assessment findings. If the client complains of sudden chest pain or sudden shortness of breath, it may indicate that the client has developed pulmonary embolism. Thrombophlebitis and extravasation. While infusing antifibrinolytics, monitor the client closely for thrombophlebitis, which is inflammation of the vein which is associated with clot formation, and also extravasation, which is leakage of the fluid into the surrounding tissues. So monitor closely for these two complications. Myopathy. Antifibrinolytics, they may cause myopathy, so we should be observing the client closely for any concerns of muscle pain or fatigue or weakness. Then we have over-the-counter drugs and ASA. Instruct the client not to use over-the-counter drugs or ASA because they interact with antifibrinolytics, and so we should instruct the client to consult with the primary healthcare provider prior to taking any over-the-counter medications or ASA. So that's all about antifibrinolytics.